So in my office, a lot of patients come asking for a mommy makeover. And one of the things they're interested in is an abdominoplasty, otherwise known as a tummy tuck. But the real question is, what exactly is the procedure? What does a tummy tuck accomplish? And I break it down. A tummy tuck can take care of 3 different areas. Number 1 is the skin. A lot of women that have finished childbearing or have had pregnancies or even have had weight loss, they have loose skin in the abdominal area. So tummy tuck helps remove the excess skin. Number 2, it helps tighten muscle. So the 6-pack muscles or rectus abdominis muscles become lax or loose after pregnancy, and in the tummy tuck procedure, I actually tighten the muscles and recreate the contour that a female had once had. The third thing is treating any stubborn or excess fat deposits. So in the abdomen, the flanks, or even the back, or anywhere in the trunk, any stubborn fat deposits can be removed the same time as doing a tummy tuck, usually by doing liposuction. So when I do a tummy tuck, very often, almost always actually, I do liposuction at the same time. They kind of go hand in hand. The tummy tuck helps tighten the abdominal muscles and remove extra skin. The liposuction is an adjunct to remove stubborn or excess fat deposits either in the abdomen or in the flanks or the back. It also helps recreate abdominal definition and contours. So a lot of my patients who come to my office wanting a tummy tuck, a big question is the recovery timeline. These days we don't have a lot of time. We want to go back to work. We want to go back to our workout regimens. And this is a really big concern for all the patients that come in. What I typically tell them is, it takes about a week to go back to work. I recommend 3 weeks to kind of doing light duties, 6 weeks before going back to a full exercise regimen or getting into the water. So a big thing with a tummy tuck, a lot of patients ask is, if I get a tummy tuck, can I get pregnant later? The truth is, yes, you can, but the big issue with that is, if you do get pregnant, it's gonna naturally change your body. You're gonna have weight gain, weight loss, the skin and muscle can stretch. So the only thing I could say is the results of the tummy tuck are probably not gonna last. So another question a lot of patients ask me is, when is the right time to have a tummy tuck? And what I tell them, the best time to have a tummy tuck or even a mommy makeover is once you've finished having kids, you're at an ideal weight, and then you have all the procedures done to achieve the body of your dreams. So a big concern with the tummy tuck that a lot of patients ask me about is the incision. A lot of patients are concerned about different things with surgery. They're worried about going under, they're worried about having surgery with an incision and a scar in the future. And you know, what I tell them is, I personalize and customize a plan that is meant for that patient based on the examination. So some women, they need a small mini tummy tuck scar. There are other patients that actually have to go all the way around and do a circumferential. So all I can really say is, I'm gonna pick the incision length that is going to give me the best aesthetic outcome. So I have a lot of patients ask me, am I a candidate for a mini or a full tummy tuck? What's better for me? And what I tell them is, there's many different types of tummy tucks, many different approaches. So some patients that have less skin laxity, or it's just isolated to the area underneath the belly button, those are candidates for a mini tummy tuck. It is rare for a patient to be a candidate for a mini tummy tuck. Most patients that have had pregnancies, that have had children, typically need a traditional or a full tummy tuck, which does involve an incision that goes from one hip to the other hip.